Hi, Eric. I'm Dr. Baca. It's nice to see you again.
You too.
How are you doing?
Good. My meds have been working.
Okay, so the last time you came in, we diagnosed you with chlamydia. Did you complete your treatment and take all of your medication?
Mm-hmm.
Did you have any issues with that?
Nope.
Okay, right now, are you having any symptoms?
Nope.
Okay, great. I wanted to talk to you a little bit today about safe sex, if that's okay. I wanted to know more about who you're having sex with now.
Yeah. People.
Okay, people. So by people, do you mean men or women or both?
It depends.
It depends. Okay. Eric, one thing I should have mentioned at the beginning of our visit is that everything that you say in this room is confidential. The only time I would tell anyone else is if I thought you were a danger to yourself or to someone else. But anything that we talk about in terms of, sex is confidential. If you're willing to share a little bit more with me in terms of your sexual practices, that might help me figure out additional types of screening that you need, and that way we can keep you healthy.
Well, I don't really have normal sex, so condoms don't really come to mind.
Okay, so when you say that you don't have normal sex, what does that mean?
BDSM.
Okay, BDSM. By BDSM, what do you mean?
Bondage, domination, sadomasochism.
Okay, that's a mouthful. So when you engage in BDSM, what is your particular role?
Sub.
Sub. So if you're sub, what do you do?
You give someone else complete control of your body.
Okay, so when you're engaging in those types of activities, are you usually having sex orally, having vaginal intercourse, having sex rectally with men or with women?
I've done all of them.
Okay, so you've done all of that. Well, thank you for sharing. I know that's very personal and it's difficult to share that information with the provider, but it's helpful for me to know. I'm wondering if your experience with chlamydia has made you think differently about condom use or safe sex.
Mm-hmm. Even if they're annoying, I'd rather not be stale and disgusting for so long.
Okay, so you felt disgusting in which way?
Well, I was too infected to have sex. It was gross.
Okay, that makes sense. I'm wondering if these BDSM experiences that you're having are experiences that you enjoy.
Mm-hmm.
Okay, the reason I ask is that sometimes when people are engaging in those types of sexual activities, sometimes they're forced or they feel pressured by another person. Has that ever been the case for you?
Nope.
No? Okay. I'm wondering if you have any other, stressors that we should talk about. How have things been at home for you?
Tolerable.
Okay, so tolerable, that doesn't sound great. Why just tolerable?
Most things.
How are things with your parents and how's your relationship?
Well, they're not there that much. I mean, they're there for a decent amount of the time, but sometimes they don't even make food or say goodnight, so they're more like roommates that I don't really like.
Okay, well that sounds stressful. That sounds like it's a big challenge for someone your age. I know that you've already had your treatment for chlamydia and we've tested you for all your other sexually transmitted infections, but it sounds like things might be stressful for you right now. I wanted to give you this sheet. This is a sheet of resiliency factors, and they're kind of things that someone your age needs to be healthy physically and mentally. right now I feel like it's a challenge for you because your parents maybe aren't as supportive as they could be. We have a limited amount of time in our visit today, but I feel like it could be really useful for you to see a therapist and talk about, the struggles that you might be having at home and with your parents. You could try it once and see how it goes. It doesn't mean that you're signing up to do it long term. How does that sound to you?
Good, actually.
Okay, well, we have a therapist here in the clinic, and so we can make that follow-up appointment for you right now. So if you want to just, stay here, our medical assistant will come in and make that appointment for you, and you can see how it goes. And if you ever need anything else, you can come back into the clinic and we can check things and see how things are going.
Okay.
Do you have any other questions about anything?
Mm-mm.
No? Okay. Well, it was good to see you again.
You too. So, we use a constructive feedback method called the hamburger approach. I'll tell you what you did well, and that's the garnish. I'll tell you what needs improvement, and that's the meat. And I'll tell you my overall opinion of the experience, and that is the bun. So for the garnish, you did really well at keeping the situation calm and peaceful, and you were really good at not being judgmental, and you made him feel normal, and you didn't react strangely to anything he was saying like he sort of expected you to. For the meat, you didn't mention confidentiality as soon as you should have, and so it took him a little bit longer to open up to you. And then you strongly stressed having safe sex, but you didn't give him any resources to obtain the tools. He knew he needed to use condoms, but he didn't know where to get condoms or if there's ways to get them for free and things like that. And for the bun, it was a very good meeting and overall very effective.
Okay, great. Thank you for your feedback.
Of course.